good. We're recording.
My communicable disease is on methicillin-resistant Staphylococcus aureus, or MRSA. What is MRSA? MRSA is a type of staph infection that is resistant to most common antibiotics, specifically beta-lactam, which includes methicillin, penicillin, amoxicillin, and oxacillin. It's often a nosocomial disease. This means that it's hospital-acquired. Usually people get it after surgery and they get infected on their wound. There are two types, community-acquired and healthcare-acquired. Usually it's healthcare-acquired. Symptoms and possible complications. The symptoms include skin boils, inflamed skin, blisters, and swelling. It's usually red marks on the skin that often have pus or some kind of fluid underneath it. It's also warm to the touch. Possible complications equal sepsis, pneumonia, cellitis, which is a serious infection, bloodstream infections, surgical complications such as infections on the wound and surgical site.
You haven't got the diagnosis yet, right?
No, sir. And in very rare occasions, death when the organs get infected by the bacteria. This graph shows how common it is. So complications for surgery is 7%, cellitis, which is the serious infections, is 41%, pneumonia is 17%, and septicemia, which is the bloodstream infection, is 15%. Transmission is often direct skin-to-skin contact with people who are infected with MRSA, or indirect contact with infected areas, so that areas that have the bacteria on it, when you touch it, you can get infected. The most common type of infection is after surgery when you're in a hospital and your surgical wound gets infected with MRSA. It is often also developed through persistent use of antibiotics. If you have a staph infection and you are constantly using antibiotics which is unnecessary, then the staph infection can turn into MRSA, which is the resistant bacteria. Disease course, so if a patient walks in to a hospital with MRSA, first they get infected from the skin-to-skin contact or from surgery, and then the patient becomes colonized with the bacteria, which means the bacteria grows in the body.
Computers closed.
And the infection such as those symptoms is the incubation period, which is usually 1 to 10 days. And after because the patient is usually in the hospital, it is often quickly caught, and they're being able to be treated with antibiotics quickly. Diagnosis is often through lab culture. So the primary physician will get a sample from the wound that is infected, the tissue or the fluid, and they test for the antibiotic that is resistant to bacteria, which is a bacterial culture. They often use a rapid molecular test, usually PCR, to test for this. Also, if the physician has reason to believe that the infection has gone deeper into the bloodstream, they use a blood test. Or if the bacteria has gone into organs or bones, they do imaging tests like X-rays or MRI. Because MRSA is resistant to several antibiotics, the treatment must be very specific. First, the primary physician, like your doctor or the nurse, consists of its fluid with a knife or something, and then they treat it with antibiotics like vancomycin, which is for more severe infection, Bactrim, and doxycycline. Usually, this whole process is done with your primary care physician or a dermatologist because it's usually a skin infection. And if the infection goes deeper into your body and affects your organs or bones or something, an infectious disease specialist will be dealt with it. Frequency of MRSA. 33% of people have staph already in their bodies, usually in their nose, but overall 2% of people have the MRSA strand. The target audience is usually patients or people with their immune system is compromised, so hospital patients usually right after surgery when the wound is exposed. Elderly people, because with age their immune system decreases, and young children because their immune system has not grown to its full extent. In countries with high antibiotic consumptions or good healthcare systems where they're able to give antibiotics freely like this, these are the countries with the most cases of MRSA, like the Americas, Asia, the Mediterranean region, Australia, and also in Europe. So this is a graph that shows this. The red is the areas with the most. So like I said, the Americas, America over here, South America, and Europe, some countries in Africa, Mediterranean region, and Australia. My bad. For prevention, just wash your hands and clean your wounds and make sure that they're covered. After you clean them, and then you rewrap them with new materials that isn't already used or worn down. What's most important is washing yourself and make sure that there's no spread of the infection. And for healthcare workers, proper PPE like gloves, gowns, the goggles when you're treating patients with infections so you don't spread it to other people. And my reflection, I've learned the importance of personal hygiene and to prevent the spread of infection. Personal hygiene is very important. You gotta wash yourself and make sure that there's no bacteria on your body and you can't spread the infection to other people. I've also learned the need to follow standard precaution and infection control as a healthcare physician. Your hospital most likely have guidelines for this to stop the spread of infection and make sure that the other patients do not get infected. And these are my sources.